Welcome, folks. We'll give people another couple minutes to jump on. Um, and I apologize in advance because I have a little bit of background noise where I am. Welcome again. As we have some new folks on, we're just giving people another couple minutes to get on. Good morning again, folks. We are just giving people another minute to get on, um, especially as this is the first day back from a long weekend for a lot of folks. Welcome, good morning. We're giving folks another 30 seconds to get on, and then we'll get started. And I apologize. Again, I have a little background noise today. All right, we'll go ahead and get started. I think we might still have a few people joining. Um, my name, good morning. My name is Kathy Kilrain Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director at Maine Equal Justice, and I chair the MaineCare Advisory Committee. I did just want to remind folks, and I'll say this again later, that I we do need a vice chair who helps out if I can't be here. And can help lend some support around preparation for meetings. And if you're interested in being vice chair, please let me know. Or you could also let Kayla Sargent know, and we can make sure that that gets shared with others. We're going to kick off with introductions. So ask if folks can introduce yourselves with your names, pronouns, the organization, or what brings you here today. And I'm hopefully going to catch a couple people whose names have changed from the list that's online. But if I make a mistake, you'll help me figure it out. So we'll do what we normally do, which is I will say the names of folks who are on the MAC member list, and alternates when appropriate, and then we'll pass it over to the Office of MaineCare Services to introduce themselves, and then we'll try to catch any MAC members that we missed. And those of you who are here as guests, will have a chance then to come off mute and introduce yourselves, or you can introduce yourselves in the chat. So again, name, pronouns, your organization, or what brings you here today. And we'll start with Miriam Bashir. Enos El-Harbi. Norma Desjardins.
Hi, I'm Norma Desjardins from Presque Isle and representing St. Apollonia Dental Clinic. and I use she, her pronouns.
Thank you. Catherine Brandt. Jessica Drenning. Jamie Bork. Nielsa Ayanli. Adam Bloom Piakopoulos.
Hi everyone, Adam Bloom Pykopoulos. I use he, him pronouns, and I am representing the Alliance for Addiction and Mental Health Services. Thank you.
Kathy Dion. Becca Matasovich. Or Kaylee Hess.
Hey Kathy, it's Becca. Sorry. Children's Oral Health Network of Maine. And I don't know, there's a bad Zoom link out there on a calendar invite. So I don't know if anyone has the ability to delete that, but I think I do the same thing every month. I'm sorry.
Oh no, I didn't know that. I'll flag that for Lisa Weaver, who helps manage the calendar link. Vicky McCarty.
Good morning, Vicky McCarty, Consumer Counsel System of Maine.
Rachel Collmore.
Good morning, everybody. Rachel Collmore, Consumers for Affordable Healthcare, she, her, hers.
Sarah Squires.
Good morning, Sarah Squires, she, her pronouns, Public Policy Director, Intake Supervisor at Disability Rights Maine.
Gia Drew. Susan White.
Good morning, Susan White, representing the Home Health and Hospice Alliance, she, her, hers.
Catherine Hamilton. Leo Delicata.
Good morning, Leo Delicata, he, him pronouns, legal services for Maine elders.
Sarah Lewis. I think Laura Cortez is not here today, but maybe Mark Eves is.
Yes, good morning, Kathy. You're correct. Laura's out of the country, standing in for her as a Maxby alternative, also Executive Director of Woodford's Family Services. Good morning.
Rachel Dyer.
Hi, I'm Rachel Dyer. I work for the Maine Developmental Disabilities Council and I use she, her pronouns.
David Winslow. Ann Sedlak. Bobby Martin. Or Hannah Hudson. Candy Henderly.
Good morning, Candy Sherman, she, her, hers. I am the Director of Health for the Penobscot Nation.
Teresa Cochran.
Good morning, Teresa Cochran, Senior Director for the Center for Healing and Recovery for Wabanaki Public Health and Wellness, she, her, hers, pronouns. Thank you.
Thank you. And I'll pass it over now to the Office of Maine Care Services. And Kayla, I'm going to start with you.
Okay, thanks, Kathy. Hi, everyone. Kayla Sargent. I'm the Associate Director of Strategic Planning and Communications at Maine Care, and I use she, her pronouns, and I will pass it over to Sarah Fisher.
Good morning, everyone. I'm Sarah Fisher. I'm the Maine Care Outreach Specialist for OMS, and I use she, her pronouns. I'll pass it to Sana.
Good morning, everybody. I'm Sana Osman, Member Engagement Manager at the Office of Maine Care Services, and I'll pass it on to Courtney.
Good morning, Courtney Pladson. I'm the Maine Care Medical Director and I use she, her pronouns, and I will pass it over to Becky.
Hi, I'm the EPSDT Program Coordinator with Policy Unit at the Office of Maine Care Services. Who's left? Kristen?
Good morning, everyone. Kristen Merrill, Senior Policy Manager for the Office of Main Care Services, she, her pronouns. I will pass it to Mandy.
Morning, Amanda Lee, Rate Setting Coordinator at Main Care. I use she, her pronouns. And who's left?
I'm here.
Oh, okay.
I can go. Good morning, everyone. Michelle Probert, Main Care Director. Nice to see folks this morning. And if anyone else is here, please shout out.
Hi, Molly Slotsnick, Chief Operating Officer, Office of Main Care Services. Lisa, did you go? Is Lisa on?
No, I am here. Lisa Weaver, Office of Main Care Services, she, her, hers. Thank you. And I think that's everybody.
Thank you. Ian Yaffe, do you want to introduce yourself as another DHHS staff?
Yeah, sorry, it was making sure everybody at OMS had finished. Ian Yaffe, Director of the Office for Family Independence here at DHHS.
Are there any MAC members or alternates who we missed in the first round of introductions? Is there anyone who's here as a guest who'd like to introduce themselves? You can take yourself off mute or you can do it in the chat. Great. Well, welcome. Good morning on this first business day of September. I know it's a busy time of year for a lot of folks as we transition, not quite giving up on summer yet, but into the beginnings of fall. I will kick off with our first agenda item, which is any updates around the unenrollment of the continuous unwinding of the continuous enrollment, or any other OFI related updates.
Sure. Well, good morning. Thanks for having me here today. I think as folks here are probably pretty familiar with, we are now officially at the tail end of the unwinding process for the continuous coverage requirement. And so I know that I've shared a lot of information about that over the past couple meetings, and I figured I would stay fairly brief. Today, I will put a link in the chat to our renewals dashboard, which is not updated yet for the end of August, but it has data through the end of July. And so as of the end of July, we had approximately 40,000 main care members who were due for a renewal that had not yet been completed during the unwinding process. A large number of those individuals were scheduled for renewal that was due at the end of August. So when we have the data that comes out next week for the month of August, we'll have a better sense of how many people were able to be retained or how many people will close as a result of failure to return their renewals. I would sort of highlight for this group that, as we've been mentioning for the past couple months, we do expect to see larger closure rates during the next 2 months or the next 3 months, September, October and November. Those are when the closures will be sent out for renewals that were due in August, September, and October, respectively. And so that's sort of where we currently stand in terms of who still has renewals that are due for processing. So as of, the end of July, about 40,000 members had renewals that were still due. That, again, had a large number of those individuals who were due at the end of August, and we'll share information next week about how many members are still currently pending as of today, and how many members were closed, with, again, the note that we expect those numbers to go up now that we've implemented the passive renewal process at the individual level. So all of the procedural denial reasons are back in full effect. And so in terms of what I think members here should know is that still over 350,000 or so members were able to be successfully renewed during the unwinding process. We'll complete that process at the end of October. And so when you're talking to individual members, I think the information is still, if you get a renewal form, whether it's an unwinding renewal or a regular renewal, because now the vast majority of people have done their unwinding renewals and they're back to a regular renewal cycle, to remind people that they need to respond to those renewal notices. And to let people know that we need to have their current contact information in order to be able to process renewals for people and to let them know about those notices. And then for members that receive closures as a result of unwinding or for any reason, it doesn't have to be unwinding. There's a 90-day reconsideration period. So if people receive a closure notice because they didn't return their renewals, they can submit that renewal within 90 days of the closure notice and then be reinstated to coverage with no loss in coverage, or no gap in coverage, sorry. And we are still automatically referring any members who close to the state-based marketplace at coverme.gov for consideration of any insurance that they might be able to get through there, as well as subsidies that can help cover the cost of that insurance. So anyway, that was probably not longer than a short update, but I'm happy to answer any questions that you have about unwinding. Again, we'll have much more information next week when we have the blog posts updated. I think since we met last time, we also posted the demographic data of who was in the sort of 40,000 pending population. And then subsequently have shared that a couple of times with different groups of people, but that's all available on our website as well at maincare.gov/unwinding.
Thank you, Ian. Any questions?
Kathy, this
Oh,
is,
go ahead.
yeah, hi Kathy, this is Sarah Squires from Disability Rights Maine, and I'm unable to find my little raise hand button, so I'm sorry. I don't know if it's a question or an observation, or just something, I don't know, do with it what you will. I recently worked with Ian and his staff to resolve some issues regarding individuals who were notified that their benefits were being terminated based on their reviews because they were deemed over income for community main care. And as it turns out, both individuals were receiving waiver services in the HCBS program. So they were actually eligible for long-term care main care. And as I understand it, there's a disconnect between OFI and ODES in terms of who's receiving waiver benefits. And so that when the eligibility specialists are doing the renewals and reviewing, there's nothing that automatically alerts them to the receipt of waiver services and where they should be considered at a higher income level. And I realize that there's multiple reasons for that. But I just wonder if there is a way to flag those individuals, even if it's just something on the file that says they're a waiver recipient, maybe not necessarily what waiver, whatnot. And I know that there's a lot being done by OFI to identify these individuals and ensure that people with disabilities are not kicked off main care. I'm in no way faulting OFI, because I think that my experience with them and reaching out to Ian and the staff was extremely positive, and was, these individuals were able to keep their benefits. But just overall, I just want to highlight that that's sort of a kink in the system.
Yeah, I appreciate that, Sarah. And I don't, unfortunately, Jess isn't here today. She's out of the office, so I don't have an update on sort of how many people may be impacted by that issue, but I will send her a note and then just have a follow-up for next month's meeting about just returning to this topic and just, you know, how many people we think are impacted and what we're currently doing to see if we can better get that information. But I don't have a lot more information. Otherwise, I think if you still work with folks who, I mean, anytime that somebody's receiving an eligibility decision that you think is incorrect, let us know. And we will, you know, make sure we look at it. And for that particular situation, I'll get more information from Jess about what the timeline might be or what sort of overall status we have on that issue from a more systems perspective instead of an individual one-by-one member perspective. But thank you for raising that.
Yeah, thank you, Sarah. Any other questions or comments? Okay, thanks. And I'll also share out the links that you've shared in following this meeting. So folks who aren't here have them too.
Yeah, and those links are the same essentially every month. So if you're wanting to know when the new data for August is released, it'll be at the same links. And I don't have a specific date, but I would typically we are able to post that information by like the 15th or so. So it should be the end of next week that we see an update to the renewals dashboard.
Great, thank you. Next up are any communications updates from MaineCare. Kayla?
Thanks, Kathy. I have a couple of updates for you. The service provider tax repeal due for January 1st. We are still working on developing some communications tools for that, but we anticipate to be able to share those this week. So what you'll see later this week is an e-message along with a code list and frequently asked questions document that should help support with some more information around what's going to happen with that. And then I also want to flag that we are working on a communications plan for both members and providers regarding changes to copays beginning October 1st. So a general update on that, just for your awareness, is that copays will be turning back on for Section 40 home health services, Section 45 hospital services, Section 55 laboratory services, Section 60 medical supplies and durable medical equipment, Section 80 pharmacy services, Section 90 physician services for special benefits waiver only, and then Section 101 medical imaging services. And the communications plan that we're working on will have additional information that'll be forthcoming, including details like tiered structures for copays, copay exemptions, and a list of services that will not require a copay. I did want to flag that newly added to that list of services that will not require a copay is Section 65 behavioral health services. So that's a loaded update, more to come, but just wanted you all to know that we are working on a plan for communicating that broadly. Any questions?
I usually try to keep my eyes open for those kinds of announcements, Kayla, but if you flag it for me once you send something out to the list, I can also make sure that everyone on this list gets it. And I know this is helpful information for us because we can let our legal services folks know that if they start getting questions about copays, that's what's going on.
Absolutely. I can flag both the provider facing messaging and the member facing messaging for you all.
Thank you.
Thank you.
And Kayla, sorry if I know you noted that the behavioral health copays would not be coming back. And if you said this, sorry if I'm being redundant, but that is related to a bill that the department had that both simplified copay structures, but also eliminated copays for community-based behavioral health services, and also made it clear in statute because there are some conflicting areas that there are not copays for primary care services either.
I didn't share that. Thank you, Michelle.
And that wasn't from this past session. It was from the session before that.
Kathy, I have a quick question for Kayla, and I can't find my hand either, Sarah, so not alone today. I assume with the communications, it'll list out the number, the services that are impacted and process and all that stuff. Okay.
Yes, definitely. And particularly the member communications will provide a table of all copay details, so that members will be well aware of what's coming.
Excellent. Thank you.
No problem.
And it's totally fine to take yourself off mute if you can't figure out how to raise your hand. But as Jillian notes in the chat, I think for a lot of people, their Zoom has changed. So now the hand raise is not its own separate thing. It's under the react icon. So if you click on that, you'll see all kinds of reactions, but also the ability to raise and lower your hand. Any other questions or thoughts about Kayla's updates? Okay, so I'll pass it over to you, Michelle, for any other updates from MaineCare.
Great, thank you. So this may take away from Mandy Lee's update a little bit, so sorry, Mandy, but we did have our rate determination kickoff for this is a mouthful, so excuse me as I read it off. Home and community-based services for clinical therapy, care coordination, supportive skills building, and assistive technology services. So this is a range of broadly defined home and community-based services. What they mostly have in common is a clinical element, and we're trying to make sure that we are touching on similar services across a broad range of sections, which include 12, 18, 19, 20, 21, 29, 40, 96, and 102. Paul Sissier joined last week to kick it off. I understand it was very well attended, which is great. I was hoping to join, but could not for personal reasons. And just as a reminder for folks, in alignment with our MaineCare rate reform bill, part of our effort is to see where there may be appropriate Medicare rates to benchmark. I will call out that some of amongst the services we're looking at in these sections are services related to or that are physical therapy, speech, OT, PT, that are currently paid at different amounts than our other speech, OT, PT, separate sections of policy, which are now benchmarked to Medicare where appropriate. And so generally speaking, we're looking for a greater alignment where possible here, but we also anticipate that there are services that may require full rate studies, for example. And so this is a broad rate determination. We have different subcategories of services. They might not all be on precisely the same timeline, just because we know that there are need in these areas, especially a lot of rates related to nursing services, which haven't been updated in a while. So we want to perform these rate determinations to assess what will be needed to update those rates. All right, so that is one update. Also just wanted to note, and stealing from other folks' updates again, so this might be taking away from policy, but just noting that we have engaged in emergency rulemaking for dental services. As a reminder, unfortunately, under our current rate methodology, when we went to update the benchmarks with newer data, it was actually going to result in net reductions to reimbursement to dental services, which we did not want to do. And so in order to prevent that, we had to engage in emergency rulemaking to amend the policy. So we are still in the process of assessing when we may be able to revisit that overall methodology. And I will also note that a lot has happened with our hospital reimbursement in the past month. We did we had emergency rulemaking go live. Paired with that emergency rulemaking, we also have proposed regular rulemaking for hospital reimbursement. And we also went live with those reimbursement changes. The reimbursement changes that were unequivocally positive in nature went retroactive to July 1. There are other changes that were effective on August 9th, which is the same date that the budget became effective and appropriations became available. I will also flag that because we really like it when things are complicated, there are additional changes that are slated for January 1. For hospital reimbursement, and there will be another round of rulemaking to fully complete those changes. These are all affiliated with the same rate determination process that we went through because of the scope and complexity of some of these changes. We had to kind of as well as the different impacts that they could have on individual hospitals, we had to kind of stagger the go live dates. Again, both from a systems perspective, as well as the fact that we can only make changes prospectively when it is possible that an individual provider might not benefit from it or be neutral regarding a specific change. Let's see. And I'll just say at a very high level, just as a reminder for folks who have not been tracking, our hospital reimbursement had not been updated for the most part in over a decade. We were still using methodology that was intended to capture acuity of patients and relative intensity of services that had also not been updated in over a decade. So it really needed to be updated. And so with this rulemaking and reimbursement changes, we are improving our alignment with Medicare. We are making sure that our methodology is doing a much better job of tracking relative intensity of services, as well as patient acuity. We have taken steps away from cost reimbursement. Some providers, hospitals that kind of had their own reimbursement methodologies have been aligned with other like hospitals. And we are also looking to improve the relationship between reimbursement and higher value care. All right. So I think that is it for me. I guess I will also just flag that before too long, we will start our process of engaging around our rate determination schedule for calendar year 2025, recognizing that our current rate determination schedule is still in process, but we'll be planning for the future. And as I have, I think at the past, well, at least at the past MAC and the past rate setting subcommittee, I just do want to say again that we are anticipating that it will be a difficult budget season. A lot of factors that frankly, the pandemic as well as unwinding have masked a bit, are now coming to the forefront. And so that includes, we made a lot of rate investments during COVID, but then didn't necessarily see the accompanying increases in spending we expected because there was still workforce shortage and we weren't having as much utilization, but we are seeing more of the full brunt of that. We have expanded coverage in a number of areas. We have not seen the same amount of disenrollment based on unwinding as we anticipated. So there are a lot of different factors that are resulting in greater projected expenditures for main care. And that is paired with what are lower revenue projections looking into the longer term. So I just say that because while we are committed to continue to do our rate determinations and determine what rates should be, I do not know, and there will be a statewide conversation likely around to what extent we will be able to continue with the same pace of efforts that we've engaged in around rate investments and cost of living as well.
Any questions? I just want to note from the chat that that Jillian had lifted up some confusion around whether section 21 and 29 were included in the rate setting initiative that was mentioned earlier.
I can speak a little bit to that. So there are two current determinations in progress, as Michelle mentioned, the home and community-based nursing and clinical, et cetera, as well as the lifespan waiver services. And so I would suggest that if folks are interested in the services that are included in each of the studies, they refer to the listing that's on our rate reform website. There is an area on that website that lists current initiatives in process. And within that, there are multiple links that contain either service category lists. There are also recordings from kickoff meetings or engagement with providers, a number of resources under each of the individual determinations. And then I think to get to Jillian's specific question about certain providers, if a certain service specifies a provider type, it would be relevant under that particular determination. If a service does not specify a provider type and can be formed by multiple providers, then we would consider all providers during that determination. Does that answer your question, Jillian?
So I was on the call. I didn't raise it up. I think it was Ray Nagel that, and there's a little confusion of maybe the lifespan waiver. What's the date that it starts?
That's already in progress.
Okay, so
wait, hold on. So the waiver is not in progress. The rate determination for lifespan related services is in progress. And I will also note that we use shorthand sometimes. And so we may call it the lifespan rate determination, but it is not just about lifespan. It is also intended to apply to services that will be in the new lifespan waiver, but that also exist, for example, in 21 and 29. So it is so that lifespan rate determination is broader than just the lifespan waiver because it is our intent to be consistent around what our reimbursement is for services that are the same under different sections of policy. And we have made sure that we're not duplicating efforts between the lifespan and related services rate determination and this HCBS clinical. So they're not duplicative with each other. And I get that it is confusing because I believe we are doing the right thing and trying to make sure we are being consistent in reimbursement across numerous sections of policy, but that also makes it harder when you're trying to explain what sections of policy are involved, et cetera. It's much easier when we just say, we're doing a rate determination study for this whole one section of policy, and it's not that easy in this case.
No, that's exactly what I was looking for, because Ray just raised up that, well, I know you have the lifespan waiver, but you're not addressing the 21 and 29 as it existed over here. So I think there was confusion if, the people that maybe, I can't remember how the program worked, but if they opted in to stay with 21 and not move to the lifespan waiver, that funding wasn't going to increase is what the concern was. So that answers the question. Thank you.
And I also do want to separate the rate determination process from the seeking an appropriation and budget initiative to implement the rates, right? We have been in relatively good budgetary times for the past few years where we have largely been able to do a rate determination and then implement that rate determination. And we might not be able to see the same one-to-one actions right now. So rate determination does not necessarily equal immediate implementation. We are going to continue with the rate determinations and share that information, which should be, which is intended to inform the budget process, but a rate determination does not translate immediately into rate adjustments.
That's an important clarification. Thanks, Michelle. And can you just say very quickly what you mean when you're talking about lifespan waiver? Because I imagine there's folks like me on the call who don't exactly know what that is.
I will try. Gosh, I wish Tom Leet were on the call today, but I don't think that he is. So the lifespan waiver, I don't have notes in front of me either. It's called lifespan in part because it's intended to be able to follow someone through their lifespan, starting at, I want to say age 15. It could be 16, moving forward. And is intended to bring greater flexibility to the services that they may receive from kind of the youth transition onward. Anybody else who wants to help me with other important talking points on the lifespan waiver, please jump in. Otherwise, Kathy, we can also be prepared to speak a little bit more in depth at a subsequent meeting.
No worries. I just was trying to help in case folks didn't know at all what you're talking about. And one thing to note is we'll talk more about this later in the meeting, but I'm hoping that this small group of folks who are going to help with some of our governance questions can also help us think about, like, how can we help people on this call better understand things that aren't their scope of interest necessarily, so that they don't feel lost. And sometimes that can make it hard to follow the meeting. And especially as we work to try to have more MaineCare members be a part of the meeting, wanting to recognize that not everybody's going to have the depth of policy knowledge that maybe some folks on here have. Charlie?
I was just going to say, I'm going to find, and I'll put in the chat, that the department has an excellent overview of the lifespan waiver on the website. And I'll stick that in the chat in a minute.
Thanks, Charlie.
Well, thank you all. Any other questions for Michelle? Okay. Then let's move on to our next topic, which is provider updates. And Jillian, I know you had volunteered to temporarily take on convening the provider group. I'm not sure if you were able to do that in August, but or if there are any other updates that you'd like to share, or anyone else from that group.
So I did attempt twice to send out the listserv that Mallory had. I blasted twice looking to see if people wanted to reconvene and if they had topics to reconvene. And I was going to try to use the dates that Mallory had already booked because she never canceled them, so they were still there. The only response I got was from one of the heads of the alliances saying, hey, if you get a group together, I'll join, but no provider responded. I don't know if it's just a really busy time of year. The providers I did respond, a few actually did respond saying I'm retiring, good luck. So I didn't get anybody ready. It seems like a lot of organizations heads are retiring. So we're kind of losing a lot of the people that have the knowledge to sit on those groups, but I am looking for members to join the group, and I will just do it as a placeholder until the group can get somebody, that can tend to it the way that I think it needs to be. I mean, I'm just, place holding it. I did have one follow-up just from something that we talked about as the provider group back in January, and it was something I actually raised up, is I did see an email come through that MaineCare was going to finalize the digital signing criteria because there were two parts of MaineCare policy that conflicted with one another. So I got this internal before the meeting a month ago We're gonna get this to you, but it was never finalized to my knowledge. So we're still looking for something on digital signing just to make sure, you know, in the next few years, we're not audited and then, hey, that wasn't a, you know, an authorized digital signing or, so we're still looking for some sort of e-message from policy, on that. I don't know if anybody has any updates on that, but that was one thing from the group that I know that, still is unresolved.
Yeah, Jillian, let me check on that. That should be coming out shortly. So let me find out what the status is.
And then there was one other internal thing that I think had to be lifted off main care and go to contracting with, I think it was Henry, I don't know if I'm saying his name right, Ackelson. It was just that we as an agency ourselves found it very beneficial that the KEPRO allowed 30 days because in our health homes, there's like a day of attestation, right? And it's on the 21st. So every member in that health home, you have to attest to on that date. So allowing 10 days is pretty limited for us to have just 10 days before the 21st for all members in our health home to get that KEPRO. And what we had asked for was the provision during the pandemic that was allowed 30 days that we were asking for approval. And I think that had to be moved to contracting because it was kind of out of main care's, because I think it's part of maybe a contract that exists somewhere that that main care couldn't decide on that. But it sounded like somebody was looking into that about a month ago. And then we just didn't hear back on that either. But that was raised up in January as well. And we're trying to close the gap on that. That was also through the provider committee.
Yeah, we'll get you an update on that as well.
And then the only other thing that, again, I was the only one at this meeting, but I raised this up directly with Kenneth, and I don't know if main care is aware, but when the new licensing rules came out, they came out, you know, with like 3 days of notice, right? And there was extensive rules of this is when we're going to enforce these actions. It could have been 180 days, a year, or effective immediately. And we got a lot of effective immediatelys. Like our organization, we had to go into the portal and put the Title V thing that we were instructed because, you know, the licensing rules rolled out so quickly. Licensing hadn't licensed us yet. So we're doing that on Friday, but the portal is asking providers for bonding. And I told Ken that there's no rule in main care that requires a bond for a PSS agency. But now that maybe you're flicking the switch and calling it licensed, it's mistaking it for a home health agency. And so our agency's portal is jammed now because it wants bonding, and bonding's not required that we can find or that main care knew about. So just to kind of raise that up before all the other PSS agencies get jammed putting in their Title V with the whole relicensure process, because I don't know how many PSS agencies there are, but I thought there was probably hundreds. Just raising that up, that somehow the portal thinks that it's a bonded service.
Jillian, you said you've already been in touch with KJ about that? And did
Yes, I told him, and he had to raise it up. I don't know if it's production or it had to go higher up because he agreed with me that it was an error.
Okay.
But just
All right,
know
so
that,
sounds like he's working on it.
yeah, I just gotta wrap back with him and see if, you know, if they were able to bring an end result, but just so they can, again, I think it had to do with you added this new license and for some reason it, you know, because before it was licensed only home care agencies, home health, and I think for some reason it's pulling it forward now for all PSS agencies.
Thank you.
Thanks for those questions, Jillian. And just a reminder for folks that the provider subcommittee was formed, is it 2 years ago now, a year and a half ago, as we were making adjustments to the membership of the MAC to try to have more representation from like alliances, like the organizations where multiple providers are a part of, to represent providers at the MAC itself, and then providers move into this provider subcommittee. They're still welcome to come to the MAC and participate as Jillian has today, but to try to create a space where providers could really get into the weeds on some of the issues that they're experiencing, that maybe are a challenge to have at this space to keep everybody engaged. And so I do encourage providers to try to be a part of that group. Jillian kindly offered, Mallory Shaughnessy was convening it, but she retired. And Jillian kindly offered to temporarily convene, even though she's not a MAC member, until we could get a MAC member who wanted to be chair of that group. And so we are still looking for a chair and a vice chair of that subcommittee. And I'll make a note of that in the follow-up email as well to remind folks. Ideally, the chair at least should be a member of the MAC, a formal member of the MAC. I think that has been a successful space for some of those conversations to happen, and take them out of the big MAC meeting, but it requires participation. So if you know folks who should be a part of that meeting, please encourage them to join. And I know August in Maine is also a challenging time of year, so it might have just been that, with so many people taking time off. Any other questions or thoughts from providers today?
Yeah, they would just ask, and Julie, I think it is summertime. I do think it's still a valuable group to continue to have, and I think there'll be issues that come up that providers will want to go there to discuss. And it's been, from my observation, it's been really helpful. The convener of that needs to be a MAC member. Is that an alternate also? Because I'm not sure there are any MAC members that are providers, which was the switch.
But that's a good point. And so Mallory was representing, she was doing it as the association.
Yeah.
That's a good point. I think it could be an alternate. I think that would be fine.
Okay. All right. Just point of clarification.
Yeah.
I think the other tricky thing is in the provider industry, there's 3 main alliances, and then the other alliance, I don't know if like the Home Care Alliance, I don't know if Lori retired but she's been replaced with someone else. So now you have 2 alliances with new heads, and I think they're trying to kind of get their feet wet and try to, learn that industry or before they kind of sign up for another thing, right? So, it's timing too. That's been a little bit tricky with 2 of the alliances losing the heads and being replaced. And so it'd be nice to have people from each alliance sign up for this because, it is important. It's just getting people at the table for it.
Thanks, Jillian. And also Laura, who's with one of the alliances, is chair of a different subcommittee, Laura Cortez. So, and I saw Adam nodding his head as you were talking about the shifts in leadership at the alliances. So I think that's a good flag. And Lori Borgoyne, I believe, is the person who replaced Lori Belden, and she's out this week, but normally would be here. We'll find our way to getting it working again. Sometimes transitions can take a little bit of time, but thank you again, Jillian, for being willing to help in the short term. And that brings us to the rate subcommittee. And I do just want to flag Laura Cortez, as we mentioned earlier, is out. She did flag that there was not a meeting in August, but that there is a meeting scheduled in September for September 23rd at 2 p.m. The information for that subcommittee can be found on the website for the MAC, but I'll also share it out with the reminder about the meeting in the follow-up email. And I don't know, Mandy, if there's, I know Michelle touched on some of the rates updates already, but if there's anything else that you want to share.
Yeah, thanks. I just wanted to call out that she mentioned we had kicked off the rate determination for the HCBS clinical rate determination. And the presented materials notice that went out has links that people would need to register for future engagement sessions. And the first one is tomorrow. So I'm going to share that notice in the chat so that people are aware of those upcoming sessions. And then I think that was really my biggest flag And then other than that, just because we've talked about, you know, the fact that there's some confusion between the two studies, we do have the rate reform website, as others had mentioned before. It would be really helpful if people could go check it out every now and then and provide some feedback to me, to, you know, if there's things we can do to make things more clear or more helpful to them on the website, or if you can't find something, I'm happy to help you find it. I do want to also mention there are some links that have been broken that I've been repairing over the past week. They were links that had gone to our vendor's website. And so their website had changed. And so now I'm going back through and just reposting information and trying not to break any prior links. But if you do go into a previous notice that links to our vendor's website, those may not be redirecting. And just so you know, if you need something, reach out to me and I should be able to get it for you. And that's it, unless anyone has questions.
Any questions? Thank you. That brings us to the dental subcommittee, and I did just want to, oops, sorry, my screen just did something weird. I did just want to flag that there was a, you might remember from our last meeting that the department has started to hold forums for dental providers to address issues and areas of help get education out to providers about dental services, some areas that have been lifted up within the subcommittee as areas of challenge, and just trying to get a space where people can ask questions and also get out accurate, clear information to people. The first one was held back in July. And then there was one on August 28th, which I couldn't actually attend, but they are moving the frequency of those forums to not be quite as quick, so that there's more time between the forums for the department to respond to things that have been lifted up within them. But that I hope continues to be a great space to engage with the provider community. As many of you know, like, because dental, well, for a host of reasons, the dental provider community wasn't as engaged with MaineCare as maybe some other areas of care that we talk about often in this space. And so since the adult dental benefit has gone online, that continues to be a challenge, is making sure that we have providers able and willing to accept MaineCare so people can get the care that they need. I also just wanted to flag another big conversation that we've had at the last couple meetings at the subcommittee is around some providers not being able to file claims through Dental Exchange, and some challenges with that. And Shannon Beggs at the department has been trying to work with folks to figure out how what's going on exactly. And hopefully we'll get some good updates next week at our next meeting to talk about where we are with that getting improved. Those are the big things that I had flagged. If anybody else from that subcommittee wants to lift anything up, please do. I did just want to name that our next meeting is a week from tomorrow. We meet on the second Wednesday of the month at noon, and that information should also be on the website, but if not, I'll make sure it is, and I'll share it out in the updates as well. And Jillian, as I was saying that, I was just thinking, if you have a second after this meeting where you could send me the date of what you expect, that if you're going to try to keep Mallory's schedule for the provider group, let me know and I'll add it to the email as well, because I don't have that calendar invite. Any questions? Great. Oops. So next up is rulemaking and waivers spa packet that you all receive in advance each month. Kristen, do you want to give any updates there?
Sure. Thanks, Kathy. For MaineCare specifically on the OMS side, I know Michelle had mentioned probably the most significant rulemakings that we've had recently are emergency dental rule, section 25, as well as its proposed rulemaking. I think just in regard to that, I would just like to emphasize that, you know, our comment period closed mid-August for our dental rule. And so the team is currently working on summarizing those and getting that packet finalized with our Attorney General's office to get that rule adopted. Michelle also mentioned the Section 45 hospital services rules, both the emergency as well as the proposed rulemaking. For that, I would just flag for folks that our public hearing is scheduled for September 10th. And our comments for that particular hospital rulemaking close on the 20th. So, please let folks know about the public hearing as well as the opportunity to comment. There are a number of changes in that rule, and we look forward to your feedback. Separate from that, I do just want to flag, as Kathy just mentioned, we do attach a monthly status update. We internally within MaineCare refer to it as the rule status update, but typically within the emails Kathy sends, it's titled with the month and year of the meeting event. I just want to flag in there that there were a few OFI rulemakings that were also adopted recently. I can't speak to those specifically, but there is quite a bit of content in that. And I know a lot of folks have asked questions over a number of months about OFI rules. So just encourage folks to check that document. And I think that's probably it for us, unless folks have any questions. Okay, thank you.
Thanks, Kristen. And thanks again to OFI and OMS both for working to get those relevant OFI rulemaking updates into that packet, because it really is helpful to have them all in one place. Okay, we are flying through our agenda today. So in terms of wrapping up, I wanted to flag in the follow-up email, I'll include a link to the doodle for I'm calling it the MAC Governance Working Group. That's probably not exactly the right name, but we can figure out our name when we come together. Some of you I know already volunteered to do that. But for those who weren't here in July, this group is, as we had talked about several times over the last few months, there's a new rule that governs the MAC that came down from CMS that is really positive in the way that it wants to make shifts for engagement of MaineCare members. And Sanaa has been working for a long time on trying to grow that engagement of members as well. So there'll be an advisory group of beneficiaries who will help be more engaged in the MAC process. And as part of that process, we're also going to be doing things like adjusting our schedule. There's some requirements around public meetings where we have space for people to provide comments that can be responded to by the department and things like that. So we thought it would be helpful to have a small group come together to create a proposal around some of these changes that we can then bring back to the full MAC. And we'd like that group to meet in the early part of the fall. So we can start thinking about getting those online. I do want to flag that whatever we propose, we're still thinking about like the intersection of how that proposal works with the BAC group, which is the member focused group that will be meeting in a bigger way soon, because we want to make sure that whatever changes we make work for members who will be a part of the MAC. So naming all that just as a reminder that this is an ongoing piece of work for us collectively that also I think relates to some of our goals around longer term strategic planning and visioning for the MAC. And then also as part of that, I'd like to try to get some feedback from folks about how can we help make the MAC a space where people have a good sense of what's going. We don't have to all be experts in everybody's areas, but like enough of a baseline understanding that we don't feel lost. And so that's one of our goals as well. And to try to think about some of the educational pieces that might be a part of that process, whether it's presentations or materials that help support things that come up all the time during MAC meetings. And we've talked about this a few times over the years and at times had some presentations to try to help better understand, for example, like the rulemaking process. But we are ever changing as a group, and also those needs are ever changing. So we'll revisit it again as part of this process. So if anyone has any questions about that, please feel free to reach out to me. I do just want to also remind folks, if you're a MAC member and you joined late after introductions, I know at least one person put their information in the chat, but make sure you put your information in the chat so Lisa can grab it for the attendance. And I also just want to remind folks that in addition to looking for a chair and hopefully vice chair of the provider subcommittee, we're also looking for a vice chair for the rate subcommittee to give Laura some support. So if you're on that subcommittee or would like to be, consider that. And then we do still need a vice chair for the whole MAC, since Mallory Shaughnessy was the vice chair and she retired. Did we fill the client spots? Well, we do have several MaineCare members who are filling the member spots that are currently required. As we move into 2025 and 2026, we need to grow the number of MaineCare members who are part of the MAC. And that's a lot of the work that Sana is doing, Sana Osman over at OMS. And that, because there does need to be a certain percentage of the MAC that is made up of members, MaineCare members, and also that group will help inform our agendas. And so we will likely see a shift to the way we do our agenda setting and some of the things we talk about in this space as a result of that change. And Jillian, I'm also just seeing your other question about, does rate setting align at all with the rewrite of policies? Do you mean with the rewrite of the MAC policies?
Well, say when you're looking at rate setting and you're setting a rate, is there ever a link to rewrite? Like for example, I'm getting ready for the licensing of PSS. And when I look back at some of the things in the policy that we've talked about that don't happen or haven't happened for 20 years that we're still waiting for rewrites on, I'm just wondering, does during the process of setting the rate and looking at all of those things, does it help drive the conversation that these policies really need to be updated? Because so the supervision of PSSs, say we have 6 different sets of rules that come from all MaineCare policies, home-based care, licensing, and now there's so much, it's like the supervision of staff is becoming overwhelming because licensing rolled out one that's far more strict than any MaineCare policy. It's like, how do we, when we're doing rate setting, say for PSS, how do we get the policies to align with the rates? So, you're talking about this is what we need for funding, but how do we also get the policies to get up to speed with the way things are now and not 15 years ago, for example? So I'm doing a lot of clarification with just the PRs to try to figure out what the real intent with PSS supervision was, because there's 6 sets of policies and it's very confusing. So I'm just hoping, like, as we're talking about rate setting, that maybe policy writing is going to follow and be updated. I don't know if sometimes, so for example, there was a reel years ago that all PSS has to be ordered by a physician. And we decided 20 years ago that that wasn't a thing and nobody's doing it under PDN. But the rules never got rewritten. It's just there's some piece of paper archived somewhere that says that you don't need a physician's signature on these, these plans of care. It's just, how do we get policy writing up to speed once you set the rates? Or like, how frequently does policy reviews happen? To kind of get policies on a rate review schedule, like a rate review schedule, but for policies.
Yeah, those are good questions, Jillian. I know those have come up in the dental space as well, and I'm sure they come up in other spaces as well. I don't know.
Kathy, I can say a few words. First, to be clear, we absolutely update our rules and in relation to the rate determination process, where we are updating, sometimes creating a new method of reimbursement that has to have rules that follow, as well as state plan amendments. And so that is all part of our plan. I will acknowledge that especially during COVID, when there was a very high volume of disaster state plan amendments that we needed to do, the focus was more so on the state plan and trying to be able to provide that immediate relief. And as a result, we did get into a backlog situation with rules being updated. We have made progress and continue to make progress on getting caught up. And that remains a goal. I will note, though, that it has certainly been the intent under my leadership since 2019 that we are very clear about where we can make an update related to guidance that is not a formal piece of rule or state plan, and where if we are making a change, we really do need policy changes to make that change, right? That it's not an issue of guidance, or as a short-term solution, if we're going to practice discretion around enforcement, that is not a go-to solution from our perspective, but it has been appropriate in limited circumstances that we document that, because the danger of kind of, oh, we agree that this doesn't really make sense. And if something happened a decade ago, nobody's here. Even if it was written on a piece of paper at some time, if nobody can produce that documentation, it's those kind of informal or like handshake agreements. We don't do that anymore, in part because it creates these issues, right? So it's, I will acknowledge that it's unfortunate, but from our perspective, if something happened in the past and we only have anecdotal evidence of that and we have no documentation, like that can't hold. So we can have a discussion about what we're doing going forward, and if it makes sense to adopt policy changes at state and or federal level accordingly, then that's fine. But I guess, like, if you're tracking in your head things that changed over a decade ago and you're waiting for policy to catch up, like, that might not be on our radar, right? So it's good for us to have an understanding of what those changes are so that we can see if we can adjust it prospectively. But it gets really messy. And that's why, again, like, our current practice is absolutely not to do things that are not in accord, that are, you know, out of compliance with our policies, as a general rule.
So if we're seeing those things still in there, do you want us to raise them up? Like, I know, you know, we have a file somewhere. These are like the hall passes we've been given. And I'm talking a long time ago, and then it just never made it into the policy. Do you want us to raise those up?
Yes, it would
just
be
point
helpful
out-
to know. Yeah.
Yeah. I know section 96 has, it's really under the plan of care section that required the doctor to sign the treatment of a PSS, but it's non-medical, and it's been deemed non-medical now by licensing, and I just have to get that section removed. Because we got a hall pass years ago, and I don't even know who wrote it. I can't remember, but I've got it in a folder over here somewhere, but it just never was revised.
Jessica or Kristen, would you add anything else from policy perspective?
No, I think you covered that. Thanks, Michelle.
Well, I guess the only thing I would say is, in those instances that you're speaking of, Jillian, and any providers or advocates or anybody that is aware of any other passes that the department has issued and you have documentation of that to share with us. If you don't know who your contact is at the department to share that information with, you can send it to me, and I'll let you know who the right person would be, as well as pass it along. So just so that we have the information on file and have chance to, you know, do an assessment, take stock of any changes for each of our sections of the benefits manual.
Thank you all. And also, I'll just say, really appreciate the intent to have things in rule, because I know for us that, like, we really, it's so important from a holding accountability perspective, because the way courts, for example, view guidance is different than the way they view rule. So that's something we're always trying to push for, is for things to be in rule. So appreciate that. I also just want to clarify. So I know Sarah Lewis is one of the phone folks that's on, and she's a member of the MAC. And welcome 766-8598. But I can't see your name. So would you be able to come off mute and just tell us your name?
Or put it in the chat since that person has been chatting.
Yeah. We just can't see your actual name to capture it. Oh, Nielsa, great, welcome. I was gonna say next, maybe Sana can help us figure out who it is. Thank you. Welcome for joining. The last thing I just wanted to name before we go is that our next meeting is in October. This is one of those months where we have an extra Monday, which means our meeting comes up quick in October. So I'll see you all then. And again, I'll follow up with some of these updates from the chat so everybody has it, even if they're not here. Any last questions or concerns? Great. Well, then I'll let you have back more of your morning and see you next month.
Bye.
Thank you. Bye.
Thank you.